everybody, it's Dr. Candice and Dr. Max at Advanced Physical Medicine, APM Chiropractic. So today what we're going to talk about is one of our favorite new treatment techniques that we've been doing in the office, voodoo floss. So if you're a CrossFitter or anybody that's active, I'm sure you've seen these bands laying around the gym. If you're a K-Star fan, you've definitely seen him use them in the Supple Leopard. But what is it actually doing? So what we do is we wrap an extremity joint with it, and what we do is put that joint through motion, and what that's doing is really causing shearing of the tissues in that region. So if you're doing an elbow, it's really causing the tissues to shear on each other, which is helping break up some of that, what we call scar tissue, and help improve the range of motion. It's also restricting a little bit of blood flow, so once you take the band off, the blood flow is rushing into that area. So Dr. Max can go over some more information about that.
So what we're going to use this for today is we're going to use this for golfer's elbow tennis elbow, which is a big thing that we kind of hear a lot of people complain about today, whether it's for lifting. Actually, you can see a lot of times with people, not just for golfing or for tennis, but even in the workplace, you're using a keyboard, or using your thumbs to text and things like that. So we're going to show you how to use this for golfer's elbow tennis, which is kind of the same application. So when you're using the mobility floss, we're going to use something called the 50-50 method. So you're going to overlap the bands about 50%. So what you want to do is you want to start distally or away from the area, and then you're going to wrap. You can just get it started here. And you're at 50% overlapping and also about 50% tension. So if I was going to stretch it out, 100% would be like this, back off about halfway, that's 50%. So we're going to go around, and we're going to, goal is to keep that same tension all the way around, go 50%. And then we're going to go over that elbow area where a lot of people complain of that golfer's elbow, which will be on the inside, or tennis elbow will be on the outside. We'll go there, keep going up. And then that's the patient, how's the tension? Is that too much or is it good? All right. And then tuck it under. And what we're going to do now is for about 90 seconds, we're going to just go through different ranges of motion. So you're going to have the patient bend and flex. You can kind of put them through, I like to think each motion should take about 10 seconds, or 2 seconds. So if you have them go through different ranges of motion, kind of add that up to 90 seconds. So you go bend and flex. You can go just the wrist up and down, get those tissues to kind of floss through there or move through there. You can go back and forth, called pronation, supination, help open up that way. You can get crazy if you want. You can go hang on a bar. You can do some push-ups, all this stuff. One thing to keep in consideration is, keep an eye on your hand. If it starts to, change color, that's fine, but you don't want to get where it's too tingly. There's going to be a little bit of tingling sensation, but you don't want it to get to the point where it's fully asleep and you can't even move your arm. So that's the cool thing about this floss this technique is all the applications you can kind of use it in the gym or just in life in general. And this is something that's very small, footprint. You could keep it outside of your desk, you keep it in your gym bag, things like that. So what we're going to do is, so after all that, we unwrap it. And the worst part about this thing is just unwrapping and then have to roll it back up. But you'll see some crazy results with people after they've done this, before and after, when they're in pain, and then after you take it off. It's just amazing with some of the things that we see. Yeah.
We recently took a class from Rock Tape on it, and we'd used voodoo bands in the past, but the class really changed our mindset, I guess.
Yeah.
And since we've been applying it in our clinic, it's really been having great results with patients, especially, shoulder, elbow, wrist, knee, ankle, foot. And it's something you can do at home too, in between treatments here in the office, to really help improve your mobility and your function. So. And then
the upcoming weeks, we're going to go through different areas. We did the elbow today, so we're going to show you different ones. Like Dr. Candice said, we're going to add those in so you can kind of get a visual to see what it looks like to put it on different spots. Where some spots you might need a little help, get like someone else to help you with the shoulder or like that. But other spots you can definitely get on your own. Just a little disclaimer, do not put this around your neck or your face. It sounds like stupid, or your waist or anything that sounds stupid, but just as a disclaimer so people know. Do not do that. All right?
Yeah, so if anything's feeling a little sticky, just not right, a little painful, a little tweaky from the gym, definitely get it wrapped up, minute and a half. You can do that 2-3 times a day. and we'll definitely see an improvement.
Yeah.
And heads up for everybody, looks like our move date is going to be March 1st, so get ready. We're excited to show the new office to you guys.
All right, guys. Have a great, well, if you're in the East Coast, have a great snow day. Otherwise, if you're in the West Coast, we'll get you guys.
Enjoy the sun.